This presentation describes the ongoing PhD work of an autistic person perceived as female, or an APPF, based in the United Kingdom, with a history and experience of current mental illness and distress. Using narrative and imagery, it describes the background to this work based on my lived experience, interspersed with an autoethnographic vignette illustrating how the use of medicalised personal data has shaped and continues to shape my selfhood to this present day. There are references to mental illness in this work. The self as experienced begins in utero, as an entirely subjective knowledge unique to each of us. This individuated self as experienced is held consciously through complex states mapped across domains that will be described in language as emotional, physical, sensory, or mental. The sum of all these is the embodied self as experienced, or a bodymind, which captures their totality. As each of us grows and learns, the development of language and ability to communicate enables description, understanding, and meaning-making of this self as experienced into a coherent selfhood, with history, narratives, and qualities associated with it and ourselves. This self-understanding and communication of the same to others is always imperfect and incomplete. Language in any form can never capture what each of us knows directly and subjectively, nor truly convey it to anyone else. I know myself as a person with sensory, mental, physical and mood states that diverge sharply from normative standards of my culture in the United Kingdom. I knew I was different in a negative way in this socio-cultural context because of how others labelled and described me, my behaviours and moods, which were not shared by them. My living and lived experience was and is one of intrinsic and extrinsic extremity in these regards. These experiences, as I have had and known them, are challenging, intense and life-changing. Many others who witness their happenings and content do not share them, nor can they relate to them. The medical and social labels applied to my behaviours, mood and emotions in these states are pathologising and medicalised. The birth of my son 12 years ago exacerbated these differences to the extent that I came to the scrutiny of mental health services because of my behavioural and mood manifestations. I was narrated and perceived through language and description which diagnosed and labelled myself as experienced as mentally, sensorially and neurodevelopmentally disordered, in the form of autism spectrum disorder, bipolar spectrum disorder, premenstrual dysphoric disorder, borderline personality disorder, sensory integration disorder. Implicit in this narration and narrative were the imbalanced power structures and rhetorical privilege inherent between professionals and patients. My autoethnographic vignette. Me, one mentally ill mother with a 6-month-old baby, recently released from an outpatient psychiatric facility, was taking on the resident psychiatrist who had returned from leave and declared I was not autistic, blocking my referral for a diagnostic assessment in the process and instead sending one to children's social care because she thought I was neglectful of my son. I knew I was going to be in for the fight of my life. I didn't realise it was the beginning of the long fight for my life, my identity and my rights that began when I chose to stop being invisible. I knew I was autistic, whatever anyone else said. I just had to make other people see it, and me too. This was the choice I made and continue to make. It is a hard choice, but the right one. At this beginning, my data becomes my armour. I apply for and receive from the hospital that treated me a body of documents over 4 inches thick, consisting of all my notes, records and clinical observations, amalgamating me as a patient and as a person at the mother and baby unit. I review everything. Nurse reported scales assessing how I interact with my baby, pharmaceutical notes, clinical risk assessments and ward observations. To truly understand the context, I have to comprehend what the document is, its compilation, what the information contains in it is, and what a professional understanding of it will be. The comments about me make me cry. When I truly understand how my actions and motivations have been interpreted and recorded by professionals for other professionals to read, with no other opportunity for me to contribute to or challenge them. Excerpt from my notes. Been walking around the unit in underwear, shorts and vest, quite revealing. Advised to put more clothes on and that there was a male visiting the ward. Doesn't acknowledge this as inappropriate. And my note to the audience is that this was a female-only ward with female-only staff, and we were told that we could make ourselves comfortable and be at home. To return. They hold the power to define me, to label me, to pathologise me. I need to gain command over my own story. Gradually, over a period of weeks and months, I stitched together a suit of scales. Each one is a tiny facet of facts from my personal data. It transforms into a glittering costume, illuminating every issue I wish to raise about my experience as a patient and the judgment I've been subjected to by those paid and trained to support me. I was clothed in this, adorned in the evidence from professionals' own records, making my complaints irrefutable. This narrative, once created, became my protection and refuge. I am discounted, humiliated, denied and ignored no more. The sense of fury that fills me becomes the means through which I battle not only to clear my name as a human being and a mother, but also to clear my head. I gain a sense of purpose to fight the fear and sense of failure that pervades my daily experience. In working with and then through this, it and I are transformed and become something new, something joined that is greater than the sum of our singular parts. I don't know what this thing is, but like my madness from before, I am able to feel the shape of it, trace the line of its power. It runs both within me and through the threads of this story that I am telling today, that has in turn become my history, which has joined with those of the millions of other female perceived, menstruating, neurodivergent people that have been discounted, locked away and denied for so long. My record and history of all this, and everything else that has happened to me in the last 12 years of my life, are captured now in my digital personal data that professionals and services create, share and interpret me through. Initially, it was only how I knew myself and my experiences. As a diagnostic formulation was conceived, labels such as autism spectrum disorder and gender dysphoria were applied to me. Taken as wayfinders, these starting points led me to alternative narratives and similar others found through and known via digital personal data and virtual interactions. Thus, myself as experienced and selfhood and how it might be described or known was split into two binary and coexisting realities. One within the boundaries of clinical or diagnostic comprehension and the other located beyond them, in my own self-knowledge and those of digital, autistic and neurodivergent communities. In this different place, outside of risk assessments, hospitals and medical notes, I found meanings and narratives that are positive and celebratory of myself and my experiences. I am still on this journey today. My current PhD work explores how the digital personal data of autistic people perceived as female, APPFs, held in welfare, medical and social care systems, affects their sense of selfhood when compared to the equivalent held and created by themselves and their communities. I am using autoethnography to explore these experiences, past and current, to develop new knowledge in APP selfhood in the context of the proliferation of digital personal data created and held by them and others within the context of the power structures that exist between each app, the professionals in their lives, and the organisational and digital systems these exist in. The novelty in my work is expressed through my use of my own personal medical and social care records, considered to be sensitive medical data. Ethical research denies the right of access to such material created about research participants by researchers. However, in doing so, this important site of data remains closed behind digital walls, as it was for me when I was labelled as mentally disordered and a bad parent. As a private citizen and data subject, I am able to apply for my medical notes. As an autoethnographer, I use them as a data source for analysis and interpretation to create new knowledge and insight. Digital personal data, interactions and interfaces which contribute to shaping self-understanding and meaning-making in myriad ways are increasing in number and prevalence. Their disruption of long-held power structures and socio-cultural narratives, such as between professional and patient, the normal and the disordered, or related to constructs like gender, will continue unabated. Apps are subject to multiple and intersecting barriers in social life, family life, and health and social care provision. This contributes to early death, often by suicide, the loss of children to adoption or fostering, poor quality of life outcomes and mental well-being. Developing understanding of selfhood as it is experienced and the influence different digital personal data has on it will enable professional practice, service design and delivery that is more responsive and adapted to our needs. Developing knowledge of digital personal data's influence on our selfhood opens up the possibility of conceiving less stigmatizing professional and popular narratives contained themselves in more accessible digital systems. It is my hope that these will help shared meaning to be made and held more equally between professionals and the people they work with. Most importantly, though, I hope that this work will help people like me understand themselves and their lives better, whilst harnessing digital technologies and personal data to live more fulfilled, richer and thriving lives in whatever way is best for them.